Hi, everybody. I am Allison Foss, and I am the Executive Director of the Myasthenia Gravis Association. We are so glad that you're here and joining us this evening to talk about sleep and myasthenia. I have a couple of announcements I want to make before we turn it over to Kathy. I want to first introduce you to our new patient care specialist, Cami Brindell. Cami is going to be working in our Kansas City area clinics and with our Kansas City area support groups. We are thrilled to have Cami on board and think she's going to be a great asset to our team. So you'll start seeing Cami on some of our Zooms. She'll probably even be leading a few. So I don't know if you want to say hello, Cami.
I do. Hello, hello. It's really great to be here. Thank you so much, Allison. And I'm looking forward to our program tonight, Kathy.
Thank you.
Thanks, Cami. Well, we also, so in addition to tonight's program, we have a busy couple of weeks. On Saturday from 10 to 11:30, we have a special presentation about the FDA's newly approved drug to treat myasthenia gravis, Vyvgart. The team from Argenx, including Dr. Deborah Galinas, is going to be speaking from 10 to 11:30. This evening, you're going to get a survey following the presentation. And if you want to register for Saturday's session and you haven't already, you can click the link and register that way. Then on Monday for our virtual monthly meetup, from 6:30 to 7:30, we have myasthenia gravis in pregnancy and women's issues. So also a pretty hot topic. Coming up in March, we have our Young Friends of Kansas City and St. Louis, and virtually anywhere since we're virtual, Young Person's Happy Hour on March 1st from 6 to 7. On March 7th, we have our youth support group where we'll be entertaining the author of the book Extraordinary. He has written about his childhood with rare disease. On March 10th, we have a program talking about the MG-ADL score from 2:30 to 4:30. And then on March 21st, I believe, on our virtual monthly meetup, we have a program on nutrition. So those will all be in the email following tonight's presentation. We'd love to have you join us. And with things being virtual right now, we have the capability to just reach people wherever they are. So we are thankful for that, for sure. We'll utilize the chat box if you have questions this evening. For Kathy, and we are going to be recording, so this will be up on our YouTube channel at a later date. I don't want to take any more time away from our special presentation this evening. I want to introduce Kathy Page. Kathy has worked as a volunteer in the sleep area for many years. She was on the board of directors for the Restless Leg Syndrome Foundation for 6 years and was the co-founding chair of the Alliance for Sleep Apnea Partners Group. She's still on the advisory board there. Kathy is currently a member of the Public Advisory Roundtable for the American Thoracic Society in the area of sleep. Kathy lives with her husband, Ken, who has myasthenia gravis on a farm in mid-Missouri. Ken is currently on the list for a liver transplant. Kathy and Ken have 3 daughters, 2 son-in-laws, 3 granddaughters, 1 grandson, 2 dogs, 4 cats, and several Black Angus cattle. Kathy, take it away.
Thank you all so much for being here tonight. First, I want to make sure you understand that I am not a doctor. I am a patient. I occasionally have insomnia. I have sleep apnea, and I have restless leg syndrome. So I know some about it, but I'm not an expert, and I'll do my best to answer questions later if you have any. And I want to say it's just amazing to me that we have this technology that we can do a meeting virtually like this. Otherwise, we wouldn't be able to talk to each other at all. So let me get started. It's estimated that 25 to 30% of the American adults have a sleep disturbance of some kind. And it's suggested that we should have 6 hours of quality sleep every night. And we know that that's not easy to do. Sleep is just as important to your health as a healthy diet and regular physical activity. It's very important. Whatever your reason for your sleep loss, it can affect you mentally and physically. So people with sleep issues always report a lower quality of life. And that's another thing to consider besides just health issues. As you know, myasthenia gravis causes weakness and fatigue of the skeletal muscles, which is caused by impaired transmissions of the nerve impulses to those muscles. So those weaknesses can affect sleep, especially in the sleep apnea area. So the issue for most people with myasthenia gravis is not, it's not well understood. I'll put it that way. It's not clear if sleep disturbances are related to the myasthenia gravis and the muscle weakness that comes from that, or if it's due to medications for the myasthenia gravis, or it's due to treatable sleep disturbances. And those disturbances are kind of things that are a lifestyle change. It could be excessive caffeine, energy drinks, maybe some herbal supplements that will affect your sleep, but aren't related to the myasthenia gravis at all. The three things that I'm going to talk about tonight are insomnia, sleep apnea, and restless leg syndrome. And with restless leg syndrome, I will usually call that RLS. So if we start with sleep complications mainly, the issue with sleep complications is not just that we're tired the next day, but it can also affect our jobs and our school performances. They aren't as good as they should be. We have a slower reaction time when we're tired and sleepy the next day, and that can cause accidents. Depression, anxiety, and often substance abuse are attributed to bad sleep habits or bad sleep. There's an increased risk of high blood pressure and heart disease. There's a lot of reasons why we may have some of these sleep issues, and for some of them there are cures, some of them medications, and some not. For insomnia, that's the difficulty of going to sleep or staying asleep. It's very common. 3 million people every year are diagnosed with insomnia. It is treatable if you go to a medical professional and not rely on a lot of things that you might find on the web. It also increases your chances of having insomnia if you have a family history of it. Stress affects everything that we have, everything we do, everything we think, and especially with COVID, there's a lot of extra stress. Life events can cause issues when you worry about them and you don't sleep well. And sometimes they're just associated with medical conditions or certain drugs that you might be taking. So the symptoms of insomnia, of course, are falling asleep, having trouble falling asleep, having trouble staying asleep, waking up way too early. You're tired, you're sleepy during the day, could be depressed, anxious, have difficulty paying attention, or have confusion, have problems focusing, remembering. As I said earlier, there's a lot of chance for increased errors of things that you're working on, maybe at work, at school. It can cause accidents, car accidents especially. And one of the things with insomnia is worrying about sleep. It's a vicious cycle. You don't sleep, so you worry about not sleeping. And so that worry about not sleeping goes back into you waking up because you're worried about not sleeping. And it's just hard to break that cycle. A lot of causes, we talked about stress. Stress is a huge cause of insomnia. I don't know if you're like me, but have you ever woken up sometime in the night, early morning, and think, oh my gosh, I didn't do this or I didn't do that? What I do when that happens is I think to myself, okay, can I do something about this? If I can, get up and do it. If I can't, then just say, I will remember it in the morning and I'll take care of it then. Or if it's something I can't take care of at all, I need to get rid of it and not think about it anymore. When we travel, a lot of times we have jet lag that can cause insomnia. And it can affect our circadian rhythms so that we're kind of like a baby that wants to be up at night and sleep during the day. Maybe we have just in general poor sleep habits. We don't go to bed when we should. We do things that will contribute to not being able to sleep. One of the things is eating too much, too late in the evening. Or if you have insomnia and you get up in the night, a lot of people, me included, will go to the refrigerator and see what there is to eat. So you need to make lifestyle changes because with insomnia, there really isn't anything that you can take some medications and they may help for a while. Maybe they'll help for a long time, but you need to think about making lifestyle changes. And we'll talk about some of those lifestyle changes later on with the other two sleep issues because they affect all of them. Insomnia, as we age, gets worse. We aren't as restful when we sleep as we get older. We go to bed earlier. We get up earlier, but we need the same amount of sleep. We need the same amount of sleep as a teenager does. And we all know how sometimes long they sleep, but we need, like I said, at least 6 hours of sleep, or as Betty White had said, you need 8 hours of beauty sleep. And if you're really ugly, you need 9. I need 10, I think. As we get older, there's also a change in activity. We don't do enough, or we have to be careful if we have myasthenia gravis along with this, that we don't do too much. You have to find that line in there between getting enough physical activity and not getting too much. Since we're less active, we're also prone to taking naps. And that is a huge no-no with insomnia. You can take power naps, but don't plan on taking a 2-hour nap. It's going to affect your sleep that night. There's a lot of changes in our health as we get older, and those can contribute to insomnia. Sometimes we have pain due to arthritis or other things. Depression, anxiety, those seem to get greater as we age. We have to get up and go to the bathroom more often. That doesn't help things either. And as we get older, the chances of us developing sleep apnea or restless leg syndrome will increase. As I said before, there's some medications that you can take, and you need to talk to your doctor about those. I wish that I had better news about ways to get past insomnia, to work through them, but there isn't a lot other than making some lifestyle changes. And like, as I said, we'll talk about those later. So let's go to sleep apnea. Sleep apnea symptoms are usually loud snoring, stop breathing during the night, and those are usually reported by your sleep partner. You don't know that you're doing that yourself. Gasping for air. When I was, before I was diagnosed with sleep apnea, I would get up to go to the bathroom and I would just need to take in big, deep breaths because I wasn't getting enough oxygen. Dry mouth when you wake up because you're usually snoring, you have your mouth open. You have headaches in the morning, insomnia, staying asleep goes with sleep apnea, excessive daytime sleepiness, difficulty paying attention, and again, irritability. Irritability goes with all of it. And I don't know sometimes if that's a symptom or if that's just us in general. I know it is for me. You seldom realize that you have sleep apnea. You may think, well, I'm snoring, but that's no big deal. You have to go by the symptoms in order to even realize that you might have it. And then it's important to go to your doctor and have some tests run. But the different types of sleep apnea, there is obstructive sleep apnea, which is the most common. And it goes along a lot with people that have myasthenia gravis because it's due to the fact that your muscles are not doing what they're supposed to do. And because of that, it lowers your oxygen levels. Your brain wakes you up to open up those airways. So you're sleeping and your brain is not telling your muscles to breathe as they should. Your oxygen levels drop. Your body will wake you up because your oxygen levels have dropped. And you won't even remember that. It happens, it's so brief, it happens so quickly that you don't even realize that it's happening. And that may happen as many as 5 to 30 or even more times a night. So you can see that you wouldn't be getting any sleep when your body is waking you up. But again, you don't realize that that's happening. And so it doesn't make any sense why you are so tired the next day. Now, with central sleep apnea, the brain doesn't send a signal at all to the muscles. And so the same thing happens. You have lack of oxygen. You wake up. And then there's also a complex sleep apnea, which is a combination of both. Some of the causes for sleep apnea, the typical one that we've always seen is an overweight white male. And while that may be true in some instances, it's not the only thing that causes sleep apnea, although excessive weight is one of them. Your neck circumference, because the thicker neck that you have, usually the narrower airwaves that you have. And men are about three times more likely to have that thick neck and to have sleep apnea than women. But women typically become sleep apnea deprived when they have gotten through menopause. For some reason that seems to set off sleep apnea. Older age, family history of sleep apnea. If you use alcohol, if you use sedatives or tranquilizers, those things minimize your breathing capacity. And so that can cause issues with sleep apnea. Smoking, people that smoke are 3 times more likely to have sleep apnea. Nasal congestion, different medical conditions like heart failure or high blood pressure, type 2 diabetes, Parkinson's, and stroke. Those things all inhibit your breathing capacity, and so that can lead to sleep apnea. The complications from sleep apnea, of course, are daytime sleepiness. Falling asleep at the wrong times are a part of sleep apnea. You have difficulty concentrating, your brain's just not working, you have brain fog. You have trouble at work, driving. There's a huge study out there about truck drivers who have sleep apnea and the high incidence of vehicle accidents that they have. A lot of times we become quick-tempered, moody, depressed, all of those things. Sleep apnea can cause high blood pressure. We think that sleep apnea is just a sleep issue, and it's not, because it can cause things like high blood pressure. It can cause heart issues, such as a heart attack, stroke, or an abnormal heartbeat, AFib, I have had 2 strokes. I have AFib, and I think it's probably due to not having a diagnosis of sleep apnea early enough in my life to stop those things from happening. Type 2 diabetes, which is also something I have, is another thing that can be caused or made worse by sleep apnea. There's one thing that you need to be aware of with sleep apnea is if you have surgery, if you're going in for surgery, you need to make sure that you tell your doctor that you have sleep apnea and what you're doing about it, how it's being treated. It can cause liver problems, abnormal liver function tests, and it can cause non-alcoholic fatty liver disease. So we need to be aware of the fact that it's not just sleep that is being curtailed by sleep apnea. It's that so many other health issues can arise because of the sleep apnea. And you need to discuss those with your doctor. But the most important thing about sleep apnea complications is the snoring and the issues that causes with your bed partner. A lot of people don't sleep together. They sleep in a different room, maybe on a different level. A friend of mine who is called the Sleep Ambassador has written a children's book, My Daddy Snores, and it talks about how mom is trying to get away from the snoring, and finally the dad goes to the doctor and is diagnosed and stops snoring. So there are things that can be done for sleep apnea, such as a sleep study. You can go in and have a sleep study. You can even nowadays have those done at home, and it will tell you how many times you wake up, how many arousals those are. It will tell you what your oxygen levels are. It will tell you if you snore or stop breathing. And so the things that you can do for those is you can use a Cpap machine, and that's what I have. Cpap stands for continuous positive airway pressure. It keeps your airways open by blowing air in. Now, as well as that works, it's hard to get used to. It's hard to get used to wearing a mask. There are different types, and they're kind of confusing. When I started out, they were talking about a pillow, a sleep apnea pillow. And I'm envisioning in my head a pillow that you sleep on. And I thought, how in the world is that going to get air into your body to stop the sleep apnea? Well, pillows are just, they're little nasal tubes, and that's what they call them. I think they should call them something different, but they kind of look like oxygen. When you're in the hospital and you have the oxygen hose in your nose, they have those. They have some masks that fit just over your nose. They have some that fit your nose and your mouth. There are different kinds, there are different fits, different sizes, and you may have to go through a lot of different masks before you find the one that works best for you. You may even have to fight on it, because a lot of the sleep, the medical profession, when they give you the machine, you don't really have a choice whether you're going to have this brand or that brand. What it looks like, a lot of times they don't really even want to give you a choice on the mask. They say, this is what you're going to use. This is how you use it. One of the issues that I found early on was when I tried on the mask, it fit good. I was sitting up and they had it on there and it fit well. And they turned the air on and it seemed to work quite well. But that night when I laid down, that mask fit completely different and it did not work. And I have to tell you, it took me months before I found a mask that I liked and made myself use it. I would wake up during the night and I would have it off, or I would take it off knowing I took it off. It's not an easy thing to do, but if you keep at it, it will help. Now, they also have a Bipap machine, which just is a different type of air coming into your system. There are oral appliances that you use. You don't use a Cpap machine, but you have to go to a special dentist for that, and they have to be fitted just right. And your mouth will be open during the night, so breathing through your mouth is sometimes a problem. And I know a friend of mine, 2 or 3 friends of mine actually, that have the oral appliances complain about drooling, that since their mouth is partly open and they can't really close it, that they have an issue with that. And one of them has even stopped using the oral appliance. You can get supplemental oxygen, which that can help. It's kind of hard to travel with that, which is an issue with the CPAP also. Surgery can be performed. That's usually the last option, and it's usually not considered until you've tried CPAP and some of the other things for at least 3 months. There are things like removing part of your soft palate with kids, maybe adenoids, tonsils, that type of thing. Most doctors want you to try other options before you try that. There is a nerve stimulation system that you can put in, and basically what it does, it's nerve stimulation implanted that will force your tongue forward. What happens a lot of times with sleep apnea is your jaw falls back and it blocks your airway. So what this does is when that happens, it gives you a shock, and it will wake you up enough that you force your tongue forward, and then it becomes a habit and you don't even wake up when you have that. I was actually on the panel, the FDA panel for approval of that item. It's something you need to consider very carefully. There's not a lot of research on how it actually works long-term. I know that if you have that, unless things have changed, I know if you have that implanted, you can't do a pacemaker if you would ever need to have a pacemaker. So there's different things to think about, and all of them you need to discuss with your doctor. There's also forums that you can look at and ask questions to say, did this work for you? Did that work for you? I'm having trouble with this. And I suggest that you find a reliable one, an active group that you can ask questions of. I think that helps as much as anything, but always make sure you check with your doctor before you try anything different. And you have to go through a doctor for a CPAP machine or plans or any of those anyway. So let's switch gears a little bit to Restless Leg Syndrome, RLS. It's more common than type 2 diabetes. A lot of people have not heard of it. A lot of people that don't believe in it. They think it's something that's made up. 7 to 8% of the population has it. And in Myasthenia Gravis patients, 43% may have restless leg syndrome. So there's no tests for restless leg syndrome, but there are symptoms. And these symptoms are pretty prevalent. They're not anything that you can ignore, that's for sure. The number one symptom of restless leg syndrome is that urge to move your legs, or sometimes it's your arms. It happens usually when you're lying down or sitting down for any time. All of a sudden you have that urge that you have to move. You can't stop it. I've had restless leg syndrome for most of my life, and I have to tell you that for me, it's the most miserable thing that I have ever gone through, and I've gone through quite a bit of stuff. It's better when you get up and move, or if you can stretch, but sometimes when you get through moving or stretching, those urges come back. It's almost always worse in the evening or at night when you're sleeping. For me, if I'm going to have symptoms, I will go to bed, and almost exactly 30 minutes after I go to bed, they start in. Starts in usually with my right leg, and then if it calms down, it will be my left leg. Sometimes it's both at the same time, but usually it's one at a time. Now, these movements and these urges aren't caused by leg cramps, arthritis, or leg swelling or anything like that. So, as I said, there's no tests for restless leg syndrome. It just goes simply by your symptoms. You can have pain. Some people do have pain. Some people have a lot of pain with restless leg syndrome. I don't. It's just the urge to move. So, how are you diagnosed with restless leg syndrome? Since there are no tests, basically all you can do is you can go to your doctor and have him listen to your symptoms. He will try to exclude any other issues that you might have, and he's going to look at your medical history. One of the things that hopefully he will check for are iron levels. Now, these are not just normal iron levels that say you're anemic. These are iron levels, ferritin levels that are in your brain that have to be checked. And it's a different type of test for that. It's a different type of medication that you would take for that. A lot of times the doctor will do these tests and he will say, well, your levels, ferritin levels, are on the low side of normal, but they're okay. No, that's not okay. Low side of normal for restless leg syndrome with ferritin iron levels can cause issues. Usually you will need to have, let me put it this way, you can have an overnight sleep study, the same as you can with sleep apnea. It doesn't really show that you have restless leg syndrome. There's nothing that's going to show up on the tests that say yes, but it will track leg movement and how often you're awake. And so sometimes those can help. I know I went in for that sleep study because I wasn't sleeping at all. I wasn't getting enough rest. And so I thought it would be good to have the restless leg syndrome checked. So when I got through with the sleep study, usually they tell you, okay, the doctor will give you a call in a couple of weeks. No, the doctor was waiting for me outside. He didn't want to talk about the restless leg syndrome at all. He wanted to talk about the fact that my oxygen levels had gone down to 86%, which showed that I had sleep apnea, which was fine. I was glad to know that. I know there was something about it, but that doesn't help my restless leg syndrome. I think one of the most important things that you can do when you have, or you suspect you have restless leg syndrome, or at subsequent visits with your doctor, to have a sleep diary, or a non-sleep diary actually. Keep track. What time did you go to bed? How often did you wake up? Did you get up and walk? Did you go back to bed? Is there something that you might have eaten? Keep track of what you eat, what you drink, what you did during the day. Were you very active? Were you sitting most of the day? And any medications that you might be taking. This is so much better to take to your doctor than if you just go and say, I'm not sleeping good. My legs are moving around. They're driving me crazy, because he has actual proof that it's happening. He gives him something easier to work with and to work on. And I just think it's really important to do that. And I think that actually keeping a sleep diary would help if you have insomnia and you want to take that to your doctor, or even the sleep apnea. If you're still not getting quality sleep, I think that helps a lot. Treatments for restless leg syndrome, the non-drug ones, make sure you have a healthy diet. Check your ferritin levels and make sure you have medication if needed for that. And avoid triggers, things that will cause your RLS to be worse. And you can check that a lot through your sleep diary. If you have caffeine before you go to bed, if you have alcohol, antihistamines are a huge no-no for people with restless leg syndrome. It will cause the RLS to go into overdrive. Sometimes people have problems with sugar or refined flour. You need to watch those in your diet, see if maybe they cause some issues. And again, exercise. You need to get some exercise, but with restless leg syndrome, there's a fine line between not enough and too much. If you do too much exercise, then you're going to have problems probably that evening with restless leg syndrome. Medications, there are medications out there that are available to help with restless leg syndrome. And the main thing, if you take medication for restless leg syndrome, make sure you take it the same time every night, because otherwise you have the wrong amount in your system. And I had a man that called me and he said, I'm taking my medicine before I go to bed. It's not helping. I wake up too early. And I said, well, what time do you go to bed? And he said, well, sometimes 10 o'clock, sometimes midnight. And I take my medicine about an hour before I go to bed. No, take it the same time, no matter what time you go to bed. Take it the same time every night. That does help. Different medications that are out there are Ropinirole or Requip, Pramipexole or Mirapex, Gabapentin, which is also known as Horizont, and Nupro. There are other medications that are off-label. That means that they're actually for something else, a different type of medication. I mean, a different type of issue, such as Parkinson's or something like that. But they also work for restless leg syndrome. There's a thing called augmentation. That means that once you're on medications, sometimes they don't work as well. You have to take them earlier and they provide less relief. And that's something you need to speak to your doctor about. Augmentation is really hard because medications will work for a while and then they don't work any longer, and then you have to try something else. And there's a huge issue going on now about opioids, the use of opioids for restless leg syndrome. Doctors don't want to prescribe that. Insurance companies don't want to pay for it. But there are some issues sometimes with RLS that it's so severe that needs to happen, and it's usually a fight. Now, there are also other treatment options that for restless leg syndrome. I don't know if some of you have heard of this, but you put a bar of soap at the end of your bed under the sheets, and that's going to help with your restless leg syndrome. I have no idea how that could possibly help with RLS, but some people swear by it and it's not hurting a thing. So if it works for you, I'm not going to tell you there's no scientific evidence that it doesn't work. Use it. It's fine. There are a lot of leg creams out there that say, oh, we have this vitamin, or we have magnesium, or we have this in it. And if you rub your legs with this, it will cure your RLS. There is no cure for RLS, none. There are only things that can maybe help the symptoms. My thought on that is you could use Aunt Betty's goose grease and rub that on your legs, and it's going to work just as good as these expensive ones, because I feel like it's more the massage of your legs than the medication itself. But again, if you find a miracle cream out there and it works for you, use it. I have a magnesium cream that sometimes helps and sometimes doesn't. So who knows? Is it really helping or not? Always discuss any of these things with your doctor. It used to be that quinine was used to treat RLS, and there was some success with that. But quinine was branded by the FDA as being unstable and dangerous. So they won't let there be more than a small amount in anything that's used. So if it says, well, this has got quinine in it, there's probably not enough in it to do any good. But it's one of those things that you just have to check and see. Several years ago, when I was on the board with the Rls Foundation, they came out with yes, there is on here a note, any use of magnesium or anything like this, if you have MG, Myasthenia Gravis, make sure you check with your doctor before you use these. But there was an advertisement that came out in magazines and on TV. It was the only advertisement that RLS had ever done. And it was actually using a medication but it had a picture of a green chair. It was a cartoon type picture, a drawing. It wasn't an actual picture of a green chair, but it was stylized. And it showed the lady having problems with RLS. And then she took the medication and she was able to stretch out on the green chair and rest. Well, people only saw the green chair, and we were absolutely overwhelmed with the emails and the requests for where can we get that green chair. My point on that is anytime that you're checking online to see if you can find information about cures or remedies for any of these things, make sure that you're going to a reputable, reliable source. And the best one for restless leg syndrome is the Rls Foundation, the Restless Leg Syndrome Foundation. They have excellent information there, and they have an incredible patient forum where you can go on and you can look for information. You can ask other people questions. It's monitored. I think it's the best one out there. It's it's very reliable, very up to date on their information. And I think that if you want to get information, that's the place to go for it. So all three of these, insomnia, sleep apnea, and restless leg syndrome, they have common symptoms. They each become more common with age. There is often depression, anxiety, irritability. They can cause other health issues. So it's hard sometimes to know what you have. And there's a very good possibility that you could have two of these or all three of these. It's something to discuss with your doctor, to be aware of and to look into. So some of the things that you can do to prevent these, all three of them, again, insomnia, sleep apnea, or restless leg syndrome, is to develop good sleep habits. That means keep your bedtimes and your wake times consistent as much as possible, even on weekends. Take your medication if you're taking that at the same time every day. Stay active. Be careful, though, of course, with becoming too active because it can cause problems with myasthenia gravis as well as restless leg syndrome. Check with your doctor or your pharmacist about any current medications you're taking to see if they might cause issues with for something else, as in the instance of restless leg syndrome. If you have allergies and you take antihistamines, you're going to cause issues with your restless leg syndrome. If you're taking medication for one and you think you have more than one sleep issue, check to see that the medication you're taking doesn't have problems, doesn't cause problems for the others. Avoid or limit taking naps. Now, I come from a long line of nap takers. I am one of the people that can take an hour-long nap and still go to sleep at the normal time each night. A lot of people can't do that. They take a longer nap and then they can't sleep that night. So I'm not saying don't take naps at all, because if you're really tired and sleepy during the day, you may need a power nap of 10, 15 minutes. Just don't make it longer than that until you know how that affects your sleep that night. Avoid completely or limit caffeine for sleep apnea or restless leg syndrome, insomnia. Caffeine is going to keep you awake, and you need to be aware of that and switch to something non-caffeine, or at least if you're going to have caffeine, have it early in the morning and not late in the afternoon. Most people don't want to hear this one, but stop smoking. It's hard to do. I know that, but it can have such health benefits for everything. Myasthenia gravis and the other sleep issues. Stop smoking. Avoid large meals before bedtime. Again, remember I said if you get up during the night, don't go into the kitchen and eat unless it's something like fruit or, something healthy for you, but avoid empty calories especially. And make your bedroom comfortable and relaxing. And how that is, that depends on you. Make sure that your bedroom is used for sleep and sex. That's it. No TV in there. that just creates a lot of problems when you already have sleep issues. Make sure that your mattress is a good one. It's comfortable. Make sure your pillows are good. Invest in good ones that are going to help you sleep. We tried some new pillows the other day and didn't like them at all. So we're still searching for some decent pillows. Make sure that your room the temperature is comfortable. So if you are a cold natured person, you might use sleeping, electric sleeping blanket. I actually have a heated mattress pad that I really, really like. If you're hot natured, you may need a fan. And I sleep the best if I have my heated mattress cranked up and a fan blowing on me. That's best. And I think part of that is because the fan causes some white noise. And it's okay to use them both. It sounds kind of strange, but if that helps you sleep, go for it. Lighting, make sure that you have good lighting. If you live in town and you have a bright light outside your window, you might want to put up some darkening curtains there. Try aromatherapy, try different things and see if they work, but make sure that your bedroom is a place for rest and relaxation. Have a bedtime ritual. Maybe it is a warm bath or shower before you go to bed. It could be reading. Make sure you don't read horror novels, though. That's not going to help you sleep at all. Maybe some soft music. That could help. Some of the music that you can get, the white noise. It may be the sound of rain. It could be something like that. But try any of those and see if that will help you sleep. And I wish I had better information on cures, or if you do this, you will no longer have insomnia or sleep apnea. But I don't. And I can only give you the information that I gave you. And I want to thank you, though, for being here this evening. And if you have any questions, if you would like to leave those, and I will do my best to answer those. Yes, there's two things of information on here about quinine, and we talked about that. Anytime you want to use, if you're thinking about using magnesium, make sure you check with your neurologist if you have myasthenia gravis, especially. Are there any other questions? Well, again, I thank you very much for being here this evening, and I hope that you got something out of my talk.
Thank you, Kathy, so much. Usually people aren't this shy, but I guess we don't have any questions this evening. So wonderful information that you passed on to us. Last chance, any questions? All right, well, Kathy, thank you again. And we appreciate everybody tuning in, and we will see you next time.
Thank you very much.
Thank you.